is Sherry. I'm your nurse today, so I'm here to do your physical assessment, okay?
Okay.
I'm going to close this blind here, well, this curtain, and so I'm going to ask you some questions, and then if you feel any pain while I'm doing the physical assessment, please let me know. I will stop.
Okay.
But before we start, are you having any pain on a pain scale from 0 being none to 10 being the most? Are you in any pain?
No, not right now.
Okay, so I'm going to go over here and wash my hands, and I will be listening to your apical pulse, and then also I'll be watching you breathe as well.
Okay.
So I'll have to open up your gown. Will that be okay?
That's fine.
Okay, so first thing that I'm going to do is I am going to ask you, can you tell me your name?
Yes. My name is Aisa.
Okay, can you tell me your date of birth?
May 18.
Do you know today's date?
Today is Wednesday, the 29th.
Okay, do you know where you are?
I'm at the hospital today.
Okay, so that tells me that my patient is alert oriented times 4. That also shows me that my patient isn't having any difficulty with any breathing. My patient isn't having any airway obstruction. My patient's chest is rising and falling as well. And also, I don't see any airway or hear any airway obstruction like wheezing. So right now, I am going to ask my patient if I can look at her oral mucosa.
Okay.
Alrighty. With my pen light, my patient's oral mucosa is pink and moist. I'm not hearing any abnormal sounds, so I don't see any obstructions or hear any obstructions. So you can question for me. Okay? So the next thing that I want to do, I just want to ask you if you can cough for me. Deep cough. Okay. And I want to get your breathing rate, which is your respiratory rate. So I'm just going to watch your chest go up and down, just regular breathing for 1 full minute while I time it and get the rate. Is that okay?
Sure.
Okay. And all you have to do is just breathe normal for me. Okay, thank you. So your respiratory rate I got at 14, so which is normal. So next what I am going to do is I'm going to listen to your lungs. Will that be okay?
Yes.
Okay. So first what I will be doing is I'm going to listen to your lungs, anterior, posterior, and laterally here. Okay, and I'm listening to your lung fields. And I'm going to listen to see if they're clear and that I'm not hearing anything abnormal. So what would be abnormal would be if I hear wheezing, and that would indicate asthma. And then I would have to go and document that and then also let the provider know, okay? And then if I hear any crackles or something like that, then, that would indicate some type of cardiac abnormalities, and then I would also document that and let the provider know, okay? So the first thing I'm going to do is just listen to your anterior, which is going to be here, and you're going to feel my stethoscope
Okay.
touch your chest here, okay?
Okay.
So I'm gonna wipe it off with my wipe.
Okay.
And I just wanna have you to take some deep breaths for me, okay?
Okay.
Over on the right side here. Okay, so that's good. So there, your lungs are clear, right, and your left lungs are clear. I didn't hear anything abnormal. So now what I'm going to do is I'm going to listen to your lungs laterally, which is going to be on the left side, and it's going to be on your right side, okay?
Okay.
Deep breath in and out for me. Okay. I'm going to come over here. Okay. All right. Okay. Your lateral lung fields are clear for auscultation.
Okay.
So now I want to do your posterior lung fields, okay? Which is going to be in your back, okay?
Okay. Done for you.
Okay. And have you do some deep breaths in and out. Okay, so your posterior lung fields are clear bilaterally. So I'm not hearing anything abnormal, like any wheezing.
Okay.
And like I said before, if I was to hear wheezing, that means that would be asthma. Could be, you know, and I would have to document, and I would have to let the provider know.
Okay.
And I didn't hear any type of bronchi, which that could be some type of obstruction in the airway. So I didn't hear any of that. I didn't hear any crackles, which that could be some type of heart abnormalities. I didn't hear any of that, okay? So next what we're going to do is I'm going to listen to your apical pulse, okay?
Okay.
And so I will be listening for 1 full minute.
Okay.
I am going to assess the rate and also the rhythm. I am listening for the lub-a-dub sound, okay? Because if I don't hear the lub-a-dub sound, then there's something that's, you know, it's abnormal. I would have to document and let the doctor know as well, okay? So I'll be listening for a whole minute, and then I'm also going to get the rate, and I'll let you know what the rate is as well, okay? And that's located, I want to let you know where it's located, which that's located at your 5th intercostal space, okay? Okay, so I got your rate, and your heart rate is at 72, and I did hear the lub-a-dub sound. I didn't hear any skipped beats, okay? So all that's normal, so thank you, and I am going to document everything. I'm going to put it in the computer. The provider's going to come in and see you, and then I'll see you the next time, okay? Thank you.
Thank you, Nurse Sharon.